Good to have, but never needed. That's how many are describing Memphis's now closed COVID overflow hospital. During the height of the pandemic, the state hurried to get the hospital up and running at the old Commercial Appeal building on Union Avenue. But over the last 2 months, it has been slowly dismantled, leaving some asking if it was taken away too soon. Memphis's COVID overflow hospital is a hospital no more. In May, the state started moving out beds and equipment.
It was an opportune time for us to go ahead and start demobilizing.
Patrick Sheehan is with TEMA, the agency that converted the hospital and dismantled it.
We were looking to create really a pressure relief valve should some of the worst case forecasts for COVID come true. And the only time we came close there was in December of 2020.
But the facility was never used.
All the money and time and resources put into that, was it worth it?
Yeah, that's a tough question and tough answers, right? We weren't sure what kinds of impacts it would have on us. And we wanted to make sure that we could continue in the state of Tennessee to make world-class healthcare available.
Dr. Manoj Jain is on the COVID-19 task force and says opening the facility was the right thing to do.
Having it in our back pocket was essential. It was really important. It brought a tremendous amount of security to me as a doctor, knowing that my patients would have somewhere to go in case the present hospitals just didn't have the capacity.
But he says things have changed since the first days of COVID, even though cases are now rising.
But what we know is that the number of cases are not relating to the number of hospitalizations because many are vaccinated. And if they do get the variant, they don't get as infected. So I'm fairly certain that we won't need that facility any longer. And I'm very comfortable with it closing.
But Dr. Jeff Warren, also on the COVID task force, thinks the closing is premature.
If you look at the numbers from 4 weeks ago, which is when they probably made the decision to close it, as they were looking at things, it looked good then. But if you look at the numbers from the last 10 days, they're very different. Okay, we're just now seeing the Delta variant hit our community.
Doctors at UT Health Science Center were slated to head up the medical staff at the overflow facility, a job they never got to do.
We were always prepared to staff it given a specific ramp-up time, which probably would have been about 10 days to begin to move patients in.
But it never got to that point. As for those who say it was a waste of a $51 million grant,
it's easy to make those calls today. It's not easy to make those calls when you really don't know the size and scope of the virus.
TEMA said